We would like to thank Biogen and Scholar Rock for their generous support of this symposium. And it's my pleasure to introduce our panel discussion on the transition to adulthood, which will be moderated by Michelle Erford. Our panelists are Ethan, Samantha, and Leah. Michelle is a licensed clinical social worker at Lurie Children's Hospital of Chicago. She has worked as a neuromuscular social worker in the MDA clinic for the last 5 years. In this role, Michelle provides patients and families with resources, coping support, and assistance with the transition to adult care. She earned her master's in social work from New York University and has previously worked in the fields of mentorship with Big Brothers Big Sisters of Chicago and as a substance use prevention specialist and counselor. Our panelists today include Ethan, Samantha, and Leah. If you joined us yesterday, you've already met Ethan, who joined us for a panel discussion about clinical trials, and we're really excited to hear from Ethan again today. Samantha grew up in North Georgia. At the age of 18, she went to Wesleyan College in Middle Georgia, where she earned a bachelor's in psychology with minors in political science and equine assistant therapy in 2019. She currently works as a travel agent and an addiction counselor and plans on completing her master's in clinical mental health counseling in May 2023. Leah received her bachelor's in psychology at Rowan University. She is currently getting her master's in counseling in educational settings and hopes to become a professional school counselor. Leah is currently working as a success coach, helping students set individualized goals in order to be successful during their college journey. Leah previously was Miss Wheelchair New Jersey 2022, where she created a platform to help students with disabilities go to college, stay in college, and graduate. She even got to go to nationals in Michigan to meet all other title holders. In her free time, she enjoys volunteering for the crisis text hotline, helping people move from a hot moment to a cool, calm one to stay safe and healthy. She also enjoys playing wheelchair hockey for the Philadelphia Flyers power play. Michelle, Ethan, Samantha, and Leah, we are so happy to have you here with us today, and we thank you so much for sharing your time with us. We will now turn the time over to you.
As Kayla mentioned, I'm Michelle. I'm one of the social workers here at Lurie Children's in Chicago, working in the MDA clinic. Thank you so much for being here today, and thank you to MDA for having us all here today. I'm really excited to hear from our three panelists today. I think the transition topic is very large, but very important and very pertinent to a lot of hopefully what our participants are going through today. So I think from my perspective, being in the clinical setting, a lot of transition for me is focused on knowing your diagnosis and asking for medications and scheduling appointments and looking for adult providers. But there's so much more involved when you think about transition to adult care. And I'm so excited to have the panelists here today to share their experience and hopefully pass along some good information and advice. So let's start with more of the health and medical care questions. So for our panelists, what was your experience like transitioning from pediatric providers to the adult care world?
I think for me, it was pretty simple. I had a great team working for me in the Children's Hospital of Atlanta, and they transitioned me pretty smoothly.
My experience was pretty similar as well. It was pretty smooth. I'm from kind of Philadelphia area, so there's a large team there. And when I was working with the doctors at the pediatrics place, they gave us a list of resources. And I also had some friends who were a little bit older than me, so they also had references and resources that I could use. So I definitely talked to my friends when I was making that transition and kind of found out what worked for them and what didn't. And then also just talking to my doctors, and then the transition from there was pretty smooth for me.
That's great.
Yeah, so turning 23 is when I was starting to do my transition from pediatric to adult care, I ended up saying yes to participate in a trial study that allowed me to stay in pediatric care. I'm still currently going to Lurie Children's Hospital. In terms of getting ready to make that transition, which I ultimately didn't, talking to my insurance providers, as well as having a really good support team and bringing up the conversation several years prior, when I was 21, 22, then when I was 23, it was always a conversation that we were having. This is how the move's going to look. I had doctor recommendations at Northwestern that they had worked closely with as they transitioned other SMA patients in the past. So there was already seemed to have been a plan of action that my doctors had gone through with previous patients, and starting that conversation early definitely allowed me to feel more confident in that transition, which again, like I said, I ultimately never made with this trial. I'm still there.
Yeah. Yeah, I'm so glad to hear that it was really smooth for all of you. And hopefully a lot of clinics do have a good plan in place so that everyone's experience is similar. Thinking back, is there anything that you think your pediatric team could have done differently or better to help?
I'm trying to think. I think for me, for the most part, they were pretty good. I feel like the only thing maybe is just the communication part, because as a child, I was so used to having my parents do everything for me. So the challenge that I had was like being more confident in myself and be able to communicate for myself. So maybe if that was addressed a little bit earlier, I might be able to start developing those skills quicker.
I think that's a great point.
I think personally, I think this discussion that we're having right now is something that I think I would have benefited from just talking to somebody that went through a similar situation and, maybe be 2, 3, 4, 5 years older than you, and they can give their personal experience on how they did it. So getting into contact with people that went through the same thing, I think would have been extremely beneficial.
Yeah, for sure.
And I agree with Ethan. I think, having basically a peer support team kind of set up would have been really beneficial and helpful. And that's really the only thing I can think of.
Yeah. I think that makes a lot of sense and definitely something good for us as providers to consider, for sure. What is helpful for all of you right now in terms of keeping track of appointments and medications and treatments? Are there any tools that's helpful for you, or what advice on how you're managing things now?
I personally use the MyChart app. My care provider has the MyChart system, and I get emails from doctors and all this other stuff. And I'm 23, so sometimes I'm not the best with my emails. So being able to have access to MyChart, where all my appointments are there, notes, follow-ups, results, test scores. If I have any medications that I might have forgot to pick up, there's a reminder right there. So having MyChart has kept my organization with navigating all my appointments and everything that encompasses them is so much more manageable. Like, it is so much more easy. Like, it's much easier to, make sure my eyes are on everything in one central place like that. So just keeping up with MyChart has been really helpful for me.
I also use MyChart, and I love it too, because it gives you a notification right on your phone. But besides that, I'm also in school right now and I'm working, so I have a lot on my plate. So I like to use Google Calendar for a lot of things because it's right on my phone as well. And it's linked to my email. So every time I have an appointment or I need to remember something, I will add it to my Google Calendar. That way I can access it. Normally, like the night before, I like to look at it to see, make sure I'm not forgetting anything and just keep it updated to help me stay organized.
I pretty much do the same thing just with the calendar that's built into my phone already. Where it's everything I do goes in there for sure.
Yeah, definitely. Having everything centralized and on your phone, which I'm assuming most of us have with us, you know, all the time is super helpful. Thinking more about post high school and the transition with higher education, choosing a career, starting to work. What were some challenges that you all faced as you left high school and moved into college or a career? And how did you overcome those?
So I had a 504 plan that we had previously talked about. One recommendation that I have when you're transitioning from high school to a higher education program, keeping that handy, you know, when you graduate high school or, you know, your last semester of high school, make sure you have copies of that 504 plan and start talking to your academic advisor or counselor at your university or college, you know, a little bit before you start, so there's a plan in place before you get there. I know that I was not the most organized with my 504 plan and all my other resources that I probably should have had ready and on hand by the time I started my first semester. So gathering that information, although it wasn't difficult, it was time sensitive and there was a little bit of pressure there. So having that ready and available before you make that transition, I would say is definitely going to be helpful for you.
So something that I really struggled with was I didn't go to public school. I went to a private school, so I didn't have a IEP or a 504 plan. So when I went to go transfer over to the college, everything was kind of new for me on how accommodations might work. And then with that, I also rely on home health aides to get around. And so I also turned 18 right before moving into college. So services, there was like a gap in it. So just finding people who could work for me and relying on state funded programs was a challenge because they weren't giving me enough hours at first. So it was hard to manage in that. But what I ended up doing during that time is using vocational rehab, and they were able to help me access aids. I know it changes by like different counties. So definitely use that as a resource and really advocate for yourself. But during that time, I hired college students to help me with my care.
I also used vocational rehab as my main resource. And I had a challenging experience with them really where, you know, they want me to go to college at home and I want to go college away. And I had to go back and forth with them for quite a while, for about 3 weeks, about caretakers and, you know, helping pay for those. Eventually, though, they did work with me, but just keeping that communication going and not backing down is my main takeaway from that experience.
Yeah. A lot of advocacy skills that are important. Yeah. So some of you touched on this a little bit already, but how and when did you talk to your college and or employer about accommodations that you might need? And were there any challenges or how did those conversations go?
So I'll talk about the employer part right now as I'm dealing with that right now exactly, actually. So I'm transitioning to a new career path right now, going from accounting to financial advising and taking a lot of these interviews. I like to bring the conversation up pretty soon. Um, it's not like I'm working in a warehouse doing financial advising and not going to be lifting heavy boxes or anything, and I won't have physical limitations, but there are other limitations that or accommodations that I need, such as time off for doctor's appointments and for, being able to work from home or maybe take Thursdays and Fridays off when I have procedures on Wednesdays. Um, and there's a lot of time that I might need off in a certain year, and I might not have enough standard PTO time with these employers. So I always like to bring that up beforehand. And when they ask for a letter or something, I have that readily available now. But bringing up the topic that I'm going to need time off um, for doctor's appointments before you get into the rest of your endeavors and a job search, I think is really important. As well as if you're scared about requesting time off, you don't always have to be specific. Um, I don't know the law exactly, but uh, speaking to like an HR director or something, they don't need specifics. Just a doctor's note saying, "Hey, this is our patient. We need time off for him." And I have never run into issues. Every employer that I've worked for is always very accommodating. They don't require specific answers or anything.
That's great.
So for the college level, I like to talk to the college pretty early. I think I might have did it once I made my final decision on what school I wanted to go to, because I wanted to make sure the house then that I was going to live in was accessible. Kind of make them aware of my needs so they can, if anything was wrong with it before, fix the problem before I attend it, which was really helpful because by the time I got there, everything ran pretty smoothly. Of course, there's always some hiccups, but as long as you're advocating for yourself, it's definitely doable. And then for working with employees, I also like to do it pretty early. That way, I get a feel for if they're accepting there because I don't want to be anywhere where they're not really accepting. So I want to make sure that wherever I work, they'll work with me. That's something that's really important to me. So having that information pretty early will help me make my decision as well if I want to work there.
Yeah, that's a great point.
For college with me, I did have that conversation. It was one of the first conversations I had. It was a historic college. It's a small private historic college, and with that comes a lot of laws that they don't have to make it accessible. So I was just very upfront and said, are y'all willing to work with me? And luckily they were. And then with work, I was scared to have those conversations at first.
Yeah.
And I didn't. And I really regret it because I had 2 jobs where they weren't accommodating and I had to suffer through that. But luckily the job I'm at now, I was upfront about it in the interview. And they have been more than accommodating and more than welcoming to me this past year. So a big change for me.
Yeah. Yeah. Thank you for sharing that experience. It's definitely, I'm sure, intimidating to have those conversations right up front. Yeah. How did you all go about choosing what you wanted to do after college, or after high school, and kind of deciding on college and career?
I can jump in. So I always knew that I really wanted to help people. So I'm going to school to be a school counselor. So I wanted to give back to other students and kind of help them along their academic journey because I feel like without the support that I had, I wasn't going to be able to do what I wanted. So I wanted to make sure I'm giving back and giving other people that opportunity too. And then I also work with college students, and I also felt like college is where I found myself. I struggled a lot, but through the different leadership skills that I developed during college, I was able to give myself a voice. So I know like I want other people to feel the same way.
That's awesome.
I'll be honest, I went to college for computer science and I interned in that respective field. Decided it wasn't for me, and I've been making a couple career pivots ever since. I've been working in computers, accounting, and now I'm going into finance. And honestly, just trying to figure it out as I go. Experience is, I think, the biggest thing that pushes me in a certain career direction. Uh, just gaining experience and finding what you find fulfilling.
For me, it was just really thinking about how much help I've had in life and how much people have stepped up for me, and I want to do something where I could do that for them. And when I was little, my mom always told me like, "Oh, you're going to be a counselor," and so here I am. And then with the travel agent thing, I think that it's so important for people, despite their ability to go and see the world, and I want to help people with disabilities do that. So that's kind of my specialty in that. Um, and I found that really rewarding as well.
Yeah. And I love that there's a lot of doors open, and um, having in mind of something that you want to do with, something that you want to study or a career, it doesn't have to be like what you end up doing for the rest of your life too, right? Like there's a lot of opportunities, and along the way you're gaining a lot of experience, which is nice. Any other suggestions from you all for our audience regarding college, employment, any, good pieces of advice?
For college, I would definitely say use your resources because at a college campus, there's so much that it can be really overwhelming. Especially for me, my first year, like I didn't get involved in as much things as I probably should have. So at first, I really thought I'd hated the college life. But my second year, I started bracing out a little bit, joining different things, and I found myself through that experience. So definitely get involved, use your resources. Also, your support system will be like a great point to use because they're there for you, especially reaching out to people who might have a similar disability who can kind of help you guide it. Because I think it was mentioned that I play wheelchair hockey. So a lot of people are a few years older than me. So it was kind of nice because they did the whole process before, and I was able to reach out to them and kind of found out what works and what doesn't. So definitely reaching out to other people for support.
I think the biggest thing I learned during my college experience and to an extent my career experience as well, don't be scared to test your limits, to push yourself a little bit, within a safe amount, of course. Um, but you're the only person that can hold you back is you, and so you have to push yourself sometimes.
I know that this was already mentioned, but I just think that it's really important to say the significance behind it. But self-advocation, I think, is huge. Uh, as you get older, there's going to be less and less people advocating on your behalf, and uh, self-advocation as you get older, I think, is huge. Whether it be in the workplace, in a school, an education environment, or just in public with strangers around you at a coffee shop. If you need help, there's self-advocation and just asking for that help, I think is really important.
Yeah, for sure. I think another aspect of transition is learning to live independently, or at least branching out, and maybe receiving care from somebody that's not your parent or guardian. And learning those self-advocacy skills, right, and asking for help. So for our panelists, I was going to ask, if you currently live on your own, what steps did you take to get there? Or if you're in the process of that, what's kind of going into that planning process?
Yeah, so I actually moved out for a little while to downtown Chicago. I live in the suburbs now. I moved out just to have some fun, be independent and see what it's like living on my own. It was great. One thing that I definitely learned is, as I am looking to move out again and purchase my first property and become more independent, something that I learned is, wherever I buy, I need to make sure it's accessible, because I thought, this is just going to be a quick thing. It's only going to be for 6-7 months that I'm going to move out, and I'll just tough through it. But finding an accessible and finding an accessible home that is easy to navigate through, and I don't have to struggle through it, I think is huge. I know I was always nervous going out because I knew that I was going to have to come back in, and coming into where I was living, the apartment building that I was in, didn't have an elevator. So going up 3 flights of stairs definitely deterred me from going out and having fun, because I always knew that I was going to have to come back and go up those stairs. So that's something that I've definitely learned, is just make sure wherever you decide to go is accessible.
I currently live at home right now, but during my undergrad, I moved out. And something that I learned from it is definitely have backups. So I ended up putting all the students that I hired to work for me in one group chat. That way, if someone had to call out or couldn't make their shift, they had to let the group chat know. That way someone else could cover. So just having a backup plan, having other people communicate, and being able to communicate for yourself and advocate for your needs is something that's really important.
I also live at home, but I did move out for my undergrad, and then I moved out with a significant other a year after my undergrad. And with that experience, I learned, if you're going to live with someone else, don't forget about your caretakers. Definitely utilize them as much as possible. And also making sure that your caretakers, you can be friends with them, but also that they take their job seriously, if that makes sense. Because I had some caretakers that would show up late and wouldn't show up at all and stuff like that, and it just got really complicated. So that was my takeaway from that experience.
Yeah, definitely. I think oftentimes a lot of young adults might feel like their parents are overprotective, or maybe have different ideas of how we should live our lives. And maybe your parents want you to stay at home for college and you'd rather go away for college. And so I'm wondering if any of you experienced any of that with your parents, and how you went about working through that or talking with them.
My mom did not want me to move away at all. She was terrified. But I eventually had to sit her down and tell her, you have to let me experience this, because if I don't, I'm not going to learn anything. And I have to do this for myself as well, to show myself that I can do it.
Yeah.
So just having those conversations, and I know I said it before, but keeping communication open, keeping it going.
I was pretty lucky. I have 3 older siblings, so I think that might have helped a little bit. My parents kind of wanted me to have the same experience that they did. So even if I was nervous, they were kind of pushing me to get out of my comfort zone and try it. So luckily with my parents, it was pretty smooth.
I'll say having an open dialogue with your parents as well, because I know that's not just with SMA um, and difficulties that you might have associated with that, but parents in general are protective and they never want to see you get hurt. So, you know, they definitely will not hold you back. That's a horrible way of saying it, but be protective. And I think the number one thing is having conversations about it, knowing your limitations, but also knowing, like was mentioned before, know your limitations, but also don't be afraid to try something new. And when a parent, you know, tries to tell you, hey, you know, you've never done that before, having a conversation about it and say, I would like to try. Is there any way that we can? Um, I think just an open dialogue is what got helped me.
Mm-hmm. For sure. Yeah, that's really important. And also, you know, like you said too, not unique to individuals with SMA, right? That's a probably conversations that a lot of us have to have when we're growing up. Um, it can be tough to meet people after high school, making friends, or even after college, right? Like making friends in the adult world or dating, things like that. Do you have any suggestions for young adults on, you know, how to make friends or date or continue relationships once you're out of high school?
My biggest advice would definitely be put yourself out there and don't be afraid to take risk. And sometimes it's okay to feel uncomfortable in a situation because that shows that you're trying, you're putting yourself out there, and in order to like eventually feel comfortable with other people or what you're doing, you have to like get through the little bit of an awkwardness phase. So definitely like put yourself out there, join as many things as you can, test out what works for you and what doesn't, and that's a great way to meet new people.
Kind of piggybacking off of that, my mind just went blank. I'm sorry, guys. I would say, don't get in your own head about it. You know, it's gonna feel awkward and it's different, but if you can make yourself do it for just 5 minutes, go to a meeting for 5 minutes, like a club meeting or something in college, and meet those people, and you'll find out you may really enjoy yourself, and it's not as awkward after a while as it was at first.
Yeah, definitely. After high school, I definitely struggled making friends. And I think just trying new experiences and finding something that you like. So if you like sewing, if you like sewing, then you know find friends that align in that hobby. And if you like concerts and singing, find friends that are associated with that hobby. Go do the activities that you enjoy, and the people that are also doing those activities uh, enjoy them too. So you'll have something in common. So I think it's such a simple answer, and a lot of the times it's overcomplicated. But do what you like doing, and you're gonna find like-minded friends that you'll get along with because they're also doing the things that you like doing.
Michelle, are you still there? We may have lost Michelle. Michelle, can you hear us? Okay, well, we may have lost Michelle, so we'll see if she can come back on. We actually do have a question that came in on the chat for you all about caregivers. Somebody was wondering do you recommend an agency for caretakers or do you prefer private care? And they don't know if you have any experience with this, but have you had live-in caretakers? Is that better? Do you all have any input on that?
So for me personally, I liked being able to hire my own caregivers. It helped me feel a little bit more in control of the situation. So at the college level, I got to like set up my own interviews. I met with students. I asked them my own personal questions. That way I know I'm not kind of getting paired up with someone random who I might not have anything interested in with. So I liked having that control. And I do not have any experience with live-in caregivers.
I do a similar thing where I do go through a company, but they do allow me to interview my own people, and then they will hire them for me because that's just the way my insurance insists on doing it. So, that's how I do that. The closest thing I've had to a living caretaker experience is I did have caretakers stay with me about 18 hours a day, and the other hours I was in class. Um, and I found that to be the best fit for me. It was a pretty smooth process, and really no complaints about it.
I apologize. I don't have too much experience with caregivers, but yeah.
No worries. Thank you all for your input. Michelle, are you back?
I am. I am so sorry.
That is okay. Technology always gets the best of us right when we need it.
It's always the worst timing.
Absolutely.
Yes, thank you all for your patience. Um, it sounds like there was just a question about caregivers. I had another question in mind for the panelists today. I think I hear a lot of when I'm chatting with patients in clinic. There is a lot of overwhelm. There's moments of discouragement living with a chronic condition, and I wonder if you all have um, uh, thoughts on how you kind of remain hopeful and optimistic and get through those tougher moments.
I do a few things. My biggest thing is always look back on what I have been through and the fact that I've came through it so far. And that there's no reason I can't do it again. And also, as an addiction counselor, I think about the Serenity Prayer a lot, which basically says it's the concept of know the difference between what you can change and what you can't change, and accept those things. So laying on that understanding really helps me, and relying on others for support too. Talking to others about what I'm going through, and just keeping that communication open and going.
Yeah.
Kind of similar to what Samantha was saying. I like to focus a lot on the things I can control. So for me, I feel like that was always like academics, leadership, getting busy in work. So just staying really busy helps me like be able to like feel like I'm doing something really feel meaningful. So it allows me not to think about some of the so bad things. And then I also, on my tough days, I like to connect with my friends who may have the same disability because I know I can talk to them and they'll know exactly how I'm feeling and they can help me feel a little bit better and just support one another.
I think everyone goes through things mentally. So, thinking about yourself and bringing yourself down on certain topics and ideas that you might feel negatively about. I think everyone goes through things, and having friends around you that you can have those conversations with, because they might be going through something totally different than you, but it's affecting them in the same way. And I value my friends close to me because I'm able to have those conversations. And I think not only does it help get, having those conversations help me get through them, but it helps them get through their issues as well. And I think mental health is, as as was discussed earlier, is a huge thing in today's world. And I feel like there's such a negative connotation with bad mental health. It's something that was frowned upon, like, oh, you have bad mental health or something. But I don't think I'm grateful that I think that negative connotation is going away, and being able to talk about it is more and more accepted. And it honestly helps just talking with friends.
Yeah, absolutely. Thank you all. Um, I I know we're kind of coming up to the end of our time slot, and I think I want to end with, do you all have any advice or words of wisdom for young adults as they kind of begin this journey of transition? Or even if you can think of something that you would say to yourself when you were 15, 16, 17, kind of getting ready to move on and tackle some of those big changes.
This was probably mentioned a bunch of times, but I wish I knew sooner. Like, it's okay to ask for help. It's not a bad thing. Using your voice to ask for helps you get what you need and deserve, and it helps you stay active as much as you can. So definitely ask for help, use your resources, and just be you.
I love it.
I think this was briefly asked. I'm not sure if it was covered too much, but something that I was always nervous about um, was getting into a relationship. And I know friends of mine who have SMA uh, also struggle with that. How do you bring up the conversation? And something that I quickly learned was, as I was going on dates, I always made sure that the dates were accessible. I never wanted to show up to a restaurant and then the reservations at the table were upstairs and there wasn't an elevator or something. Because not all, here in Chicago, not all restaurants need to have accessible seating. If they're 100 years old, they don't need to put an elevator into like a 150-year-old building.
Yeah.
So planning the unexpected, I know, is really hard to do, but as much control that you have on it, I think is really helpful. It's something that I do every single day. Whenever I plan a date, I'm always calling the restaurant ahead of time. And just being very confident. I know that friends of mine, like I said, around me with SMA are always worrisome to bring up the conversation, but just having that confidence, I think, is really important.
I think my biggest advice would be just keep putting one foot in front of another. You're going to run into challenges, things are going to get hard, but you can't stop moving. You have to keep doing your thing. And some days that's going to be really hard, but again, rely on those people for support. Use your voice and have confidence in yourself.
Yeah. You guys were great. Thank you so much. I'm confident that this was very helpful to everybody listening, and we're so grateful that you gave up some of your time today to share your experiences and hopefully help the up and coming people on this symposium with some good advice.
Absolutely. Thank you all so much for being here. If anybody does have questions, so far we've only had that one come in that we were able to talk about, Michelle, while you were having some technical difficulties. So if anybody does have any questions for our panelists, you can feel free to type that in. There's a chat box down at the lower right bottom of the screen. But we do just want to say, again, this has been just wonderful, great information. It's always so wonderful to hear it from people who've been through it and people who have experienced, and some wonderful words of wisdom were shared by all of you. So we really appreciate your time. I don't see any questions coming in, so we'll just say thank you again to Michelle, Ethan, Samantha, and Leah for sharing your time, your expertise, and your experiences with our community today. We really appreciate it.